Okay, we'll make a start. As I said, welcome to this Mental Health First Aid England webinar on supporting mental health in the return to the workplace. It's fantastic to see so many of you here today to discuss this really quite hot topic. My name's Sarah McIntosh. I'm one of the directors here at Mental Health First Aid England, and I'm going to be your chair for this webinar today. For those of you who don't know much about Mental Health First Aid England, we're a social enterprise and we have a vision to improve the mental health of the nation through our mission, I guess, to train 1 in 10 people in mental health awareness and skills across England. I know some of you will already be familiar with us and already have done work with us, so welcome to everybody. I'm really excited today to be joined by a fabulous panel of experts who are going to be providing you with some ideas around best practice and hopefully give you some thought-provoking discussion to help you think about how best you can support your people back into the physical workplace today. So we're joined today by Zara Mahmood, who's the Campaigns Officer at Business in the Community, Abby Hart, who is the HR Case Manager at Telefonica UK, and Jackie Clements, who is a freelance coach and mentor who works predominantly with third sector organisations and SMEs. In the webinar today, we're going to be broadly covering 3 discussion topics. So firstly, we're going to be exploring how employees might be feeling about their return back to the physical workplace and what you might need to think about as part of that. Secondly, we're going to be thinking about the practical steps that employers might need to make the workplace both physically safe but also a mentally healthy place to be. And finally, we're also going to think about what else employers might need to think about around their organisational culture when bringing staff back into the workplace. We'll be asking the panel to share their views and thoughts on these topics over the course of the next hour. We will be using a few live polls as we go through the session so that you can participate. All of these polls are anonymous, so feel free to vote and we can check out how you're feeling and about certain topics as we go. At the end of the webinar, we've got time to put some questions to the panel, so please do use the question and answer function within the Zoom window to pose some questions, and at the end we'll do our best to get through as many of those as we can for you. And also, just to let you know, we are recording the session today for anyone who can't attend, and we'll share this link to you and also the slides that we're using today. You'll get an email after today's session with both of these. Okay, so let's get started then. So the first kind of discussion point we're going to look at is how people are feeling about returning to the workplace. And we've got a quick poll here just to start the discussion. So we've got 2 questions for everyone on the webinar today. The first one is, how soon is your organisation planning to return back to the physical workplace? And the second is, how are your people currently feeling about returning back to the physical workplace? So in a second, you'll see a poll with both of these questions on it, and you'll need to vote. And we'll take a couple of seconds and we'll be able to share those results back with you. Okay, I'm hoping there's been enough time for you all to vote in that poll. We can share those results back with you. Okay, here we go. You should be able to see the results on screen now. So for our first question, how soon is your organisation planning to return back? We've got a real mix there. So some of you are not sure, about a fifth of you are not sure. A couple of you are saying you're not planning to return back to the workplace at all, actually, which is quite an interesting idea that I've seen quite a number of employers considering over the last few weeks and months. Quite a few have already returned back into the workplace, so a quarter of you are already back and have already had to plan ahead for this, and a few of you next few weeks and next few months. So hopefully the things that we're going to talk about today will help you to think about planning and implementing that return as well. How are people feeling about returning to the physical workplace? Okay, we've got around about a third of webinar participants today who are feeling kind of confident about coming back to the office, but a good 50% there, 60% potentially quite worried about returning back to the workplace. And I think that's quite consistent with a lot of the organisations that we work with. There's a real mix of views and feelings about wanting to get back into the workplace and how quickly that might happen as well. So I think that's very, very reflective of what we're seeing with some of the organisations that we work with as well. Okay, that's helpful for me and the panel to help guide some of the discussion. What we're going to start to do now is we're going to move into a discussion with our panel around this. So actually, I think probably Abby, you obviously work for Telefonica. Telefonica have a number of stores across the UK that have had to go through this process and open. How did you find out about how your staff were feeling, and can you kind of share with us what some of the main anxieties were amongst your staff?
Yeah, sure. So in terms of how we found out, while our stores were closed and our teams were at home, our leaders were having regular one-to-one conversations with them to check in to see how they were, discuss any concerns that they were having. And then as we began to look towards a return to store, they had an individual conversation with each of their team members to understand their personal circumstances in relation to whether they'd be able to return and whether they had any particular concerns or anxieties. In terms of how they were feeling about returning, I think the majority were feeling quite confident. And the reason for that was because we had such a great plan in place that had gone over and above government guidelines. But in the early stages of planning, I think we were hearing some concerns, mainly in relation to whether it was actually going to be safe for them to be working in the stores, where they were going to have to come into contact with the general public. And people were voicing concerns about the possibility of them catching the virus and spreading it to loved ones, and also transport. There was a lot of confusion and anxiety from people about whether they should be travelling to work on public transport. So a number of one-to-one conversations took place, and as part of that as well, a number of individuals raised concerns about their own personal circumstances as well. So for example, parents who had to look after their children at home, who would otherwise have had childcare in place that was not available, meaning that they couldn't fulfil their contracted hours as well. Other people who had health conditions, but under the government guidelines, they weren't considered needing to shield, but they were still at slightly higher risk than other people. So we were hearing from them as well, for example, people with asthma and women who were pregnant as well. So as well as their own health and safety as well, some of the concerns were actually about how they were going to carry out their day-to-day roles when they were back in store, whilst adhering to the government guidelines around safety and social distancing. So for example, how they would carry out demonstrations with mobile devices, how they'd process a return, or how they would actually process a contract when normally they're sort of sat down side by side with the customer, and the customer would actually press on buttons on the keyboard. So there was lots of concerns about the actual processes and how they would all work with the new ways of working.
That's really helpful. Thank you, Abby. I think it's quite interesting, almost the level of generic planning that needs to happen for everybody, but I'm quite interested in the concept of sort of the next layer of recognising the individual and bringing the individual into what else they may need based on their individual circumstances. Sarah, I'm going to come to you now. You work with business in the community. You've got members across the UK that you're supporting day in and day out with some of these challenges. Can you talk to us a little bit about some of the groups that might need additional support and additional considerations, and what some of their anxieties might be as well?
Sure. So one of the major concerns we're hearing from employers that we kind of work with is around the widening inequality. And, there's a reason that, we're no longer hearing talk of COVID-19 being a great leveller, because it clearly hasn't been for people with underlying health conditions, for carers, ethnic minorities, or for people who live in less affluent areas. So groups that are kind of at a higher risk of being affected by COVID-19 are looking for reassurance from their employers that it will be safe for them and that their needs are being heard upon returning to work and before that as well. And I think there's really kind of three big challenges that employers are thinking about and that they need to address for these at-risk groups. And the first is around something that Abby's already touched upon, which is the physical health aspect and taking extra care to understand additional risks for more vulnerable groups. For example, BAME people are twice as likely to die from COVID-19. So employers really have a duty to listen to these groups and to understand their needs and to assess the the unique risks that they face, so that everyone feels safe enough to return to work. We've actually outlined recommendations for employers in relation to responding to this kind of disparity that we're seeing in ethnicity and COVID-19 in our ethnicity and economic impact of COVID-19 fact sheet, which was published in April. So that's a really useful resource for anyone who wants to try and mitigate the potential disproportionate impact there. There are also issues around mental health. So lots of people are dealing with bereavement at the moment, and COVID-19 has restricted the way that people would usually grieve, and it's presenting additional challenges around social isolation and yeah, this could have a hugely damaging impact on people's mental health. And again, our wellbeing campaign team actually recently published a bereavement and grief toolkit, which outlines how employers can support with this. And finally, people are also worried about financial security, and we know that financial well-being has a huge impact on mental health, and certain groups will be hit harder economically. And I think that data plays a huge role in mitigating this, and that employers should really look at their demographic data and ensure that certain groups aren't being disproportionately affected by job cuts, for example, such as older people or, again, ethnic minorities or people with caring responsibilities. And as a kind of slightly separate note, I think it is important to remember that returning to work does have some benefits as well. It is a good thing in terms of combating social isolation and loneliness, and also reducing the spike that we've seen in domestic violence. And I think the most important thing at the moment is for employers to listen and to survey people to find out the specific risks that they're facing in their workforce. And that can only be done if you're leading with empathy and compassion and inclusion.
Brilliant, thank you, Zara. Lots and lots to think about. There's a generic challenge here. There's lots of challenges around individual circumstances. We've talked a bit about making sure we ask and we listen to employees at a sort of general level and an individual level. Jackie, I'm going to come to you. You're sort of mentoring and coaching lots of senior leaders and HR professionals around exactly this challenge at the moment. What are you finding that people are doing in order to find out how people are feeling, in order to kind of listen and act upon some of those things?
I think you're absolutely right, Sarah. There's a critical role for leaders in this, in terms of leading, as Zara says, with empathy. And the critical point is to be speaking to our members of staff, to our employees, to our colleagues. And there are obviously various mechanisms to do that. To staff networks. I think if you think about individuals, individuals to many of us will be aware of a number of articles, lots of information on social media, where and I think people are themselves and experiences aren't necessarily going to be heard and understood in the workplace.
Jackie, I'm just going to pause you there, if that's okay. I think we had a little bit of trouble hearing a couple of the things that you said there. So I'm going to ask the panelists to turn off their video, and hopefully that will help our internet. Could you kind of just summarise back sort of the 2 or 3 things that you've just covered for anyone who did experience some difficulty there? Apologies.
Yeah, no problem at all. So we're just talking about the critical role of speaking to employees. So things like making use of those but also particularly talking to individuals. And there's a particularly great tool that people might find on the individual discussions. And I think
still have a little bit of difficulty, Jackie, so I'm going to try and summarise a couple of the bits that I heard, and then it might be sensible to turn your video off if that's okay, and then try and help the bandwidth there. So I know, Jackie, you talked about the role of employee groups and employee networks, and in trade unions as well, and involving them in understanding how people are feeling, as well as different tools, so survey tools, polling tools, team meetings of ways to find out how people are feeling. And I know also at an individual level, you were just signposting there to Mind's website, where they have templates for individual wellness action plans. So feel free to go and have a look on Mind's website and download one of those. But that lends itself really nicely to talking to people at an individual level about what additional things that they might need, or that the employer might need to consider in supporting them as an individual back into the workplace as well, and using that wellness action plan to document that. We'll see how we go, Jackie, with your sound on the next discussion point. Okay, so that's a little bit about understanding and spending time really asking people how they're feeling and what kind of support they might need in relation to that, and how you do that at a general and an individual level. I'm going to move us on to look at some of the practical steps that employers are going to need to make in the workplace to firstly make it safe. So we will come on and talk specifically about making it a mentally healthy workplace in a moment, but one of the things that we often find is that if people don't feel safe at a basic level, it really impacts their psychological safety. And as we know, people who have psychological safety impacts, it can often impact their overall mental health as well. So we're going to start with talking about safety initially. So let's recap on the kind of government advice. So the government advice changed a few weeks ago from continue to work home where you can to this idea of giving employers more discretion and choice in how staff could potentially come back to the physical workplace, and how an employer could make that safe. What it did suggest was, regardless of what an employer decides to do, that they should consult closely with employees, and they should only ask people to come back to the workplace if it is safe and they take an appropriate safety measures. This takes us neatly onto our next poll for everybody on the webinar. So we're keen to understand how clear are you on the advice from the government about what you might practically need to do to create a safe workplace. We're going to share with you that poll now. And again, if you could vote on that poll, we'll give you a few seconds to participate in that, and we'll look at the various responses to that. Okay, hopefully you've all had enough time to vote now, so if we can share the results, that would be great. Okay, so again, a very mixed view here with the results. Around about, so 36% of you saying clear or very clear, 11% not really quite sure, but quite a significant amount of people who feel quite unclear about the practical steps that might need to be taken. And I suppose at the expense of the government giving people discretion around what they believe is safe and not safe, it comes at the expense of not having very strict guidelines to follow. Quite helpfully, there is quite a few bits of guidance starting to emerge for employers, and some great places to start your research if you are thinking about what you might need to put into place because you've not quite returned yet. So obviously the government website is a great place to start. It does set out some safety and social distancing measures for workplaces to put in place. The Health and Safety Executive website also has some information on this, and there's a risk assessment template that you can download and fill out so that you can understand what you might need to put in place in the specific scenarios and circumstances of your own workplace. And also the Chartered Institute for Personnel and Development has a great guide on returning back to the workplace that really considers the human side of bringing people back. It talks about how to work with employees to understand any concerns, how to collaborate with them around some of the practical steps to make the workplace safe, and also how to communicate and support people as you go through that. One of the helpful things for those of you who kind of answered that you were unsure about when you were going back into the workplace, the IPD have helpfully suggested that there should probably be 3 tests that any senior leader or HR professional should ask themselves to decide whether it's the right time to come back to the physical workplace. The first test is asking yourself, is it essential? Is it essential to bring people back to work in order to conduct your business? The second question is it sufficiently safe? And again, only if you answer yes to that should you consider bringing people back. And the third and final one, which I quite like actually, it builds further on the government's guidance to consult with people. But the third question is it mutually agreed? So have you taken the time to agree this as a collective with your workforce? I think that's really important, and again lends itself to some of the conversation we've already had with the panel today. So let's move on to think about what are some of the practical policies and practices that lots of HR teams and senior leaders around the country are attempting to put in place around safety and social distancing measures in the office. Jackie, I'm going to come to you first. Hopefully the sound will be better, but I will let you know if it's not. Can you kind of share with us maybe 2 or 3 practical things that you've heard through your networks around things that people have put in place specifically around safety and social distancing to reduce anxiety around people wanting to feel safe in the workplace?
Yeah, absolutely, Sarah. Hopefully everybody can hear me a little better now. So basically, once the organisation's decided that it is coming back to work, it needs to start thinking about risk assessment, and that's risk assessment of the tasks and the work that needs to be done. Assessments around those, but also for specific individuals, particularly individuals who are vulnerable or extremely vulnerable, or who have been shielding during. I think those is also to consider the mental health impact of that work, as well as the safety and social distancing measures. So thinking about the mental health impact of those safety and social distancing measures themselves, and in considering then those mitigating actions that factor in individual circumstances. And I think that's where the individual can help inform the organisational responses. I think it's really important for those things to be intentional and deliberate and structured, Sarah.
Okay, we did break up a little bit there, Jackie, but we did hear a bit about risk assessments, and I think you were talking about wellness action plans in conjunction with that, and that as well. So I think the first practical steps are definitely around risk assessments at a workplace level and an individual level. Abby, you've obviously, your O2 stores are open, so you've had to put some practical things in place already. I know you're looking at a phased reopening of your office as well. Are there sort of maybe 1 or 2 things that you can add in as well around things that you've been considering that might be helpful for everyone on the webinar to think about today?
Yeah, so from the perspective of our office workers, so the majority of them are still working from home, but based on the latest advice from the government, we have now commenced the first phase of reopening the office. And that means that some people can now spend time working from our site, but they need to book a slot in advance. And it does also mean that they are having the choice there. So if they want to continue working from home, then they can. But we recognise that in some situations, it is better for them to be able to come into the office. People may have unsuitable working environments at home, or there may be particular tasks that they need to come into the office. And so we are giving them that facility to do so if they want to. In terms of, you know, there's all the social distancing measures that we've put in place in line with the government guidelines around cleaning and disinfecting, enhanced cleaning protocols. We've got temperature scanning in place as people enter the site. There's measures to control the flow of people entering and exiting, and the placement of workstations has all been designed in line with the advice on social distancing as well. From the perspective of our stores estate, so we had a really robust return plan, which again was in line with the government guidelines around safety and social distancing. And before any of our stores were opened, we carried out a pilot where we tested 8 shops that carried out demonstrations on how the interactions with customers would work. And then before people began returning properly, they had a limited return to work where a maximum of 3 people were in the workplace at one time, and they tested out the new ways of working and got the premises ready for the resumption of trading. We also looked at implementing adjustments for a number of individuals following those one-to-one conversations that I mentioned that had taken place. So for example, people that had concerns about travelling on public transport, we looked at flexing their start and finish times so they could avoid travelling during peak hours. And for people that had health conditions that meant they might have been at higher risk than others, we understood what we could do for those individuals and looked at making adjustments for them. So for example, limiting the amount of contact that they actually had with the public and trying to allocate them more tasks that involved spending time in the back of house areas.
Brilliant, lots of really useful practical suggestions there. Thank you for that, Abby. Zara, I'm going to come to you now. I mean, obviously there's some temporary things that have been put in place here around safety, etc. But what about the sort of longer term sort of safety aspects that you're kind of hearing about how employers are responding to?
So what we've seen at BITC is that there's no kind of one-size-fits-all approach for employers, and that actually this is a great opportunity for employers to rethink their approach and processes by which new policies and practices are introduced. So, you know, how are leaders ensuring that health, well-being and inclusion are at the forefront of policy writing? And, you know, how quickly could your organization introduce flexible working, for example, to help workers who have caring responsibilities, you know, and, you know, how can your organization simplify the sign-off process to ensure that they can respond to the needs of their employees quickly and effectively? And it's also about giving line managers the freedom and the space to manage with empathy and compassion. That means kind of giving them the space to check in with the people that they manage. And in terms of policy, I think it's really important for employers to monitor what is and isn't working, and to really understand where the risks are, and to respond to the needs of their employees.
Great, thank you, Zara. So lots of practical safety measures that employers can think about putting in place from a safety perspective, but also thinking about, you know, giving people more clarity and certainty about the future. So thinking a bit longer term about working patterns, rotas, opening times, flexible working, thinking about policies that might support people more longer term as well to do work in a different way. I'm going to move on to talk specifically about the mental health aspects of supporting people back into the physical workplace. So obviously lots of people concerned around safety and health for lots of different reasons. But there's a lot going on in the world right now, a huge amount happening right now, and people have got all their own individual circumstances, and people's mental health have been significantly impacted across the course of the pandemic for lots of different reasons. So let's talk specifically about how we support people's mental health in that return to work. I'm going to do a poll here. So our next poll, I'd be interested to hear from our webinar participants about how confident you feel in supporting the mental health of employees as they return back into the physical workplace. So again, if you can just take a few seconds to vote, and we'll share the results with you. Again, just to reiterate, all of these slides will be available after today's session, and also a recording of the session as well. And any of the resources that we signpost, you'll also be getting a copy of as well. Okay, hopefully you've had time to vote now. We can take a look at those results. Okay, great. So 66% of you are feeling confident in terms of supporting mental health, which is fantastic. Really, really great to hear. And then we've got around about 17% who are maybe not as confident, and a group in the middle who are not quite sure, I guess. Again, I guess this is probably quite symptomatic of just generally employers supporting mental health overall, let alone specifically in relation to bringing people back to work following COVID and a pandemic. Let's start talk to the panel about the practical steps that employers can take to support the mental health and well-being of their employees as they're bringing them back to work. So in addition to all of the safety measures to help people feel safe and to help them think a bit differently about their ways of working and the hours and the days that they might work. Jackie, I'm going to come to you. Let's hope your sound is improved. If not, we'll have to move on. But again, are there sort of 2 or 3 things that you're seeing in your conversations with senior leaders and HR professionals around best practice to support mental health and the return to work?
Absolutely, Sarah. So we've talked about risk assessment, which is obviously really critical, and it's critical to consider the mental health impacts while we're doing those risk assessments. I think we've all got a sense of the mental health impact of returning to work after any long-term absence, so any period of long-term absence, and I think we all have a good understanding of the role of people managers in supporting that return. Obviously mass, so it's the volume piece that is providing a particular challenge for us at the moment. I think fundamentally that principle of, as Zara said, the principle of empathetic one-to-one conversations and check-ins is absolutely critical and remains absolutely critical. When we know that HR teams are supporting people managers to do this, and they're feeling the pressure, but know that is the right foundation. So I don't think that changes, but it is just trying to cope with the volume. I think it is worth bearing in mind that we talk quite a lot about absolutely everyone, including HR teams, including people managers, and indeed senior leaders. And I think any way that organisations can help share good self-care skills is extremely helpful for all of us. And I was reading an interesting article just the other day from that Google were talking about some of the things that they've been doing, and they've got this mantra I quite liked about equip yourself, ask about well-being, and lead with intention, that I thought gave some nice clear guidance about what's important in this particular space and thinking about mental health.
Brilliant. So yeah, absolutely prepping managers with training, perhaps extending that training out to trade union reps, employee forums or employee network chairs as well. If you can train everybody around mental health, brilliant. But definitely in the support of the return to work specifically, where people have got a good role to guide and support and help people back into the physical workplace. Completely agree. Fantastic. Thank you. Zara, I want to come to you and talk more specifically about the role of leaders in supporting people's mental health and the return to work.
Yep, so one of the things that we've seen work brilliantly is our Work Well model and roadmap, which is an evidence-based framework for embedding health and well-being into organisational culture. And it really takes a whole person, whole organisation approach, and it emphasises the role of leadership. So leaders really must prioritise their own health and well-being and communicate that to the wider workforce. And I guess an example of this is an organisation whose board analysed their health and well-being metrics and risks. And they responded to this not just by introducing new policies and by acting as role models for the rest of the for the rest of the organisation. So, for example, they would ensure that they took breaks, and that they checked in with members of staff, and that they reduced their workload wherever they could, and they made sure that that was communicated to the employees. And I think what this does is it creates an environment where employees feel empowered to make informed and healthy decisions. So yeah, I think leadership plays a really huge role in kind of setting well-being as an important issue for the rest of the organisation.
Brilliant. I've seen some fantastic examples of leaders throughout the pandemic actually being really quite open and honest about their own mental health and their own experiences of whether it be remote working or their individual circumstances. And again, being able to get your senior leadership teams, your managers to be open and sort of role model and pave the way for people to feel that it's okay to not be okay and to talk about your mental health at work. I think it's fantastic. I've seen some organisations introduce sort of coffee chats about mental health whilst they've been doing remote working, but also that's something that could be extended back into the physical workplace as well. And I've seen people implement mental health champions or networks as a result of what's been happening over the last few months, so that people have got someone to talk to regularly and openly about how they're feeling and how good a day or bad a day they're having and what they're experiencing in their own home. Abby, it's obviously a really anxious time for everybody. Again, huge importance placed on communication and giving people as much clarity and support as possible. Any additional sort of practical steps that participants today can perhaps take away with them to think about in the support of mental health?
Yeah, sure. Well, when we closed our stores, obviously the planning immediately started for reopening, and during that time we made sure that while the teams were at home, our leaders worked really hard to keep them motivated and engaged. They weren't furloughed, so they were just at home. They had weekly team and individual catch-ups with them. They took part in training and development activity, and they had the opportunity to get creative and reviewing their ways of working to see what improvements could be made, so they'd be in the best place for when they reopened. And then as information came through from the government about the possibility of reopening, the teams were then kept informed and kept up to date on the latest plans. As I mentioned before as well, they were also consulted on their personal situation. And as many individuals have personal circumstances, when managers were looking at returning to store, they were actually building their rotas around their team's availability and considering all their individual needs. In terms of communication, for us, one of our key communication tools was our internal social media platform, Workplace. And we use that tool to help us to connect all our people across the whole business and ensure that everyone stayed up to date with the latest information. And thinking about our stores people, this was particularly important for them because they were at home with no access to their work emails or the company intranet. So in a way, they were kind of cut off. So that platform was used to push out all the key information as the situation progressed and the government advice changed. Our CEO Mark also hosted a weekly live session where he provided regular updates too. And then when it came to returning back to store as lockdown measures were eased, it provided a platform for leadership to communicate all their latest plans on the return to store. And it even included a demonstration from a store which was live streamed on the social media platform, where they demonstrated the new ways of working. So I think people really valued that. And it also provided a platform for people to voice their concerns and have them responded to by senior leaders as well. Another thing I think is that they did really well was around how they were briefed on the new ways of working and the new safety measures that were being put into place. As I mentioned earlier on, I think people were having a bit of concern about how that would work in practice. So a lot of effort was putting into developing this return plan that was then communicated really well across the estate, which explained about all the new measures that were being put into place to help keep our people and our customers safe. So for example, the instructions around how to maintain social distancing, but also how the customer journey was mapped out for them as well, so that they could understand how customer interactions would work with the new measures in place. And another thing as well was around when they actually started coming into store, they were given a kind of reinduction to the workplace, where small groups of people went into the stores for just a small amount of hours, where they carried out some preparations, and they even took part in role play exercises to again demonstrate how they would actually interact with customers safely, so that they could then familiarise themselves and feel really confident about those new ways of working before they actually opened.
Brilliant. Lots of ways to be transparent, getting people to be really clear on what to expect when they're physically back in the workplace. I love the idea of the videos and sharing and reinducting people into the workplace. That's really helpful. I'm going to move on now slightly. Obviously, during lockdown, we've seen how COVID has disproportionately affected BAME communities, and also we've seen how people have been affected by the aftermath of the unlawful and tragic killing of George Floyd as well. Zara, I'm quite keen to understand, with your expertise at Business in the Community, what else might employers need to do around supporting BAME people in particular back into the workplace and supporting their mental health and well-being?
Yep, that's very true. And actually, BAME communities have been hit very hard by this virus in terms of their physical health, their mental health, and economically as well. And I think employers have a role to kind of understand the challenges that are being faced by ethnic minorities. So, in terms of physical health and safety, we're seeing much higher death rates in the BAME community. And I guess there are a number of reasons for this. For example, ethnic minorities make up a higher proportion of key workers, and they're more likely to live in multi-generational and overcrowded households. And they're less likely to have the means to avoid public transport to carry out their essential jobs. So they are in some ways overexposed to the virus, and employers can combat this by carrying out in-depth risk assessments and listening to the unique needs of each individual, and introducing remote working if that's possible, wherever it's possible. And in terms of the mental health challenges, you mentioned the George Floyd video, which has had, a huge impact on Black people's mental health. For many people, it was kind of a stark reminder of all the times that they themselves have experienced racism. And there's growing evidence as well from the British Medical Journal and the Lancet to suggest that there is collective trauma after seeing videos such as of police brutality. And there is also a growing body of research that shows that racism can lead to increased stress and increased depression, decreased self-esteem. And I think employers can kind of combat this by, first of all, acknowledging this mental distress, and making concessions where it's needed, reducing people's workload, checking in with people, and really giving employee networks the space that they need as well to influence internal policy or to set up kind of support groups as well. We've seen employee networks really stepping up and acting as a place for people to feel safe enough to express how they're feeling. And finally, I think ethnic minorities have also been disproportionately kind of bearing the economic brunt of this virus, mainly because they're overrepresented in sectors that have been hit worst by the economic crisis, such as kind of transport and storage. And yeah, I suppose employers really need to make sure that job losses don't disproportionately impact their BAME colleagues by kind of monitoring their ethnicity data, and if people have to re-interview for their roles, ensuring that there's a diverse recruitment panel, and supporting people with finding new jobs.
Brilliant, thank you, Zara. Lots of things to think about there on a practical safety level from a mental health perspective, but some consistent themes coming through really, asking how people are, asking what they need, really listening and responding to that. Individual responses and individual support plans, and flexibility, I think choice in when, how, if people return back to the workplace yet, all emerging through the conversations we've had so far. Before we move on to the kind of wider organisational culture impacts to consider as part of the return to work, I do want to reiterate, the CIPD's 3 tests. lots of people are feeling anxious for lots of different reasons around returning back to the workplace. Some people really want to get back into the workplace, and for some people, getting back into the workplace will be positive for their mental health. So one of the things that we've done at Mental Health First Aid England is we've been really clear with our staff that there is a choice about whether they wish to return back to the physical office over the next few months, and that choice should be guided particularly by employees who feel that their mental health is being impacted by having to work from home. We would absolutely prioritise in supporting back to the workplace over the next few months, whereas other members of staff who might be shielding, might be vulnerable, or maybe feeling anxious for lots of reasons about returning back, equally have the choice to remain working from home for a bit longer. So I do encourage you to really think about, is it necessary to bring everybody back quickly? Is there a way in which you can give flexibility and choice over the next few months? Because that will really help people's mental health, really help their levels of psychological safety where they're involved and they have control over what's going to happen to them over the next few months. Let's move on to look at organisational culture then. So whilst this is happening, there's a lot of complexities and challenges to think about, but also if that wasn't enough to contend with, we've also got things like bringing people back from furlough, organisations who may potentially be having to go through a downsizing or a restructure as well. So, all sorts of things to kind of layer on top of the return to work that are happening in and around your workplaces, where organisational culture is really, really impacted and has to be really thought about in terms of the intended consequences of any decision or change, but also the unintended consequences of any decision and change. So again, I'm going to go to the panel. Jackie, you've talked quite a lot about risk assessments, working with staff networks, etc. What do you think some of the cultural challenges are going to be, the wider organisational culture challenges in returning people back to the workplace that people might need to think about in their planning?
I think there's a starting point that whatever approach people are taking, that it needs to be deliberate and an intentional approach. I think there's a real opportunity for organisations to take a healthy approach to leadership in this, and try and embed this mentally and physically healthy culture, and recognising that everyone has been going through significantly challenging times, that often our organisations' leaders are the ones that have remained present all the way through and may well be dealing with their own mental health challenges as a consequence. It's worthwhile reflecting back on the opportunity to harness some of the collaborative thinking approaches and taking account of that, because that obviously helps with the self-care issue, but also helps build trust and confidence and gives people a say in what's going on, and builds that trust in their leadership teams. So harnessing that collaborative thinking, particularly where you can do that through enabling grassroots communities within organisations in ways like both Zara and Abby have described around staff networks, for example, in order to be harnessing some of these great creative ideas that will be coming from these communities. And as I say, I think doing that in a deliberate and intentional way, so that it's proactive team and community development. And I think that also helps with some of the divisions that we will undoubtedly be seeing and feeling, whether it's people returning from furlough and people who haven't been furloughed, and some of the feelings around that, some of the issues around social isolation that some people will have been experiencing, etc. That developing that grassroots community conversations means there's space to have those proactive conversations and discussions that hopefully helps start to nip some of the potential conflicts in the bud. I mean, culture doesn't happen in a vacuum. It needs leadership. And I think your point earlier on, Sarah, about the fact that often the return to work is coinciding with restructures, redundancies. In my experience of talking to organisations in the last couple of months, the very best approaches are considering for their organisation the cumulative impact of those issues when they're trying to determine the right cultural and indeed the right practical responses. So not treating them as separate processes running in parallel, but actually treating them as integrated approaches are often getting the better results.
Brilliant. Thanks, Jackie. Abby, anything you'd like to add around culture?
Yeah, sure. So I think both Zara and Jackie have also mentioned around the importance of the role leaders have to play in this, and I just wanted to emphasise really the importance of their role in creating a culture that supports positive mental health. Also, something I wanted to mention around a useful framework is the Mental Health First Aid England Conditions for Thriving framework, which talks about the 5 factors that support positive mental health. So those conditions are empowerment, which is about individuals having a say in what's best for them based on their perspective and experiences. Connectivity, which is about communication that works for the individual. Empathy, which again I know is something that Zara's mentioned a couple of times as well. So the extent to which the employee feels understood and heard. Culture, the extent to which the organisation provides a psychologically safe environment for all staff. And then finally, process, which refers to the organisation having policies and procedures that are person-centred and inclusive. And it's the role of organisational leaders to provide these conditions for their teams in order for them to thrive and succeed. And it's really important that they're role modelling the culture that they want to see to encourage that mentally healthy approach to leadership.
Brilliant, thank you, Abby. And Zara, a final point from you before we move into our question and answer session.
Yeah, so I think one thing to keep in mind, in addition to everything that Jackie and Abby have already mentioned, is to remember that there's no one-size-fits-all approach, and we don't have all the information, and everything's constantly changing. So it's really about listening, learning, and working with people. And we really advocate for the approach that Mind is taking, which is to test and learn. So test to see if any kind of new practices and policies are working, and make changes accordingly. So it's really about listening and responding, and also creating good work that enhances mental health for everyone, and thinking about things like job security and communicating really clearly to employees, and kind of thinking about workflow, and just keeping in mind that we don't have all the information, and that we need to respond to the needs of employees as they come up.
Brilliant. Thank you, Zara. That's really helpful. We're going to move into our question and answer session now. We've got a couple of questions that have come through as we've all been chatting away. So I'm going to pose some of these questions to our panel. So one of the questions, which is quite a hot topic actually, I've heard quite a number of organisations facing this challenge. Are there any thoughts from the panel on the staff that have remained in work? So they've not been furloughed, they've remained in the workplace, and often they've been kind of firefighting and trying to work their way through what needs to happen to keep their organisation, their business going, to adapt to the impacts of COVID. Quite a lot of these staff are quite tired and quite exhausting. And obviously there may be some staff returning back from furlough who are kind of raring to go. So, any ideas, suggestions, tips on kind of how you support those who in particular have remained over the next few weeks and months? Zara, shall we start with you?
Yeah, I think picking up on what you said about this coinciding with staff who are returning from furlough, I think organisations kind of can start to think about redistributing the workload so that they can tap into the kind of desire amongst staff who have been furloughed to get stuck into work, and by kind of redistributing the workflow to them, and to kind of reassure people who have been kind of bearing the brunt and having to work harder to make up for reduced capacity in their workplace, And I think they can really be supported, firstly, by encouraging an open culture where they can speak to their managers about their workload and speak to each other as well, and create that space for them to just talk about how the past few weeks have impacted them. And yeah, I just think the key thing here is to kind of look at what everyone can bring and to distribute work based on that.
Brilliant. I'm also conscious quite a number of organisations have been quite flexible with how they furloughed their staff. So in order to give those who haven't been furloughed a break, they have brought some staff back from furlough to cover things like annual leave, time off just to recharge and reboot. So there are different flexible ways that people are trying to use in order to support people who have been working continually throughout. But huge challenge. Definitely encouraging people to take annual leave, definitely redistributing work as furloughed staff may come back into the organisation is certainly going to help. But recognising it and acknowledging and celebrating what's been achieved, I think, to those. One more question just to pose to you before we wrap up, if that's okay. If there was one top tip for people in supporting the return to work, what would it be? So quite quick, short, sharp answers from the panel would be great. Zara, top tip from you? We may have lost Zara. Jackie, top tip from you?
Hi, Sarah. You'll be unsurprised to hear me saying talking to people, talking to individuals, really listening to what they've got to say and using that to inform the development of policy, structures and responses, practical responses to the situation, I think is absolutely critical.
Brilliant. And anything final from you, Abby, to add?
Well, I would just say use the resources that are available. I know that there have been a number of resources that you've mentioned throughout the webinar, so I just encourage people to use them.
Brilliant. Thank you for that. I'm going to wrap up the session today. So firstly, I'm just going to signpost participants to a few useful tools that you may want to consider. Obviously, at Mental Health First Aid England, we've got lots of training and support on offer for organisations. We have recently introduced a training course around supporting the return to work. The course itself is more broadly around any return to work scenario, so it could be parental leave, could be a long period of sickness absence, but it also is quite supportive in considering some of the scenarios around bringing people back from furlough and from remote working as well. In addition, there are a couple of other websites that you may find useful, and again, you'll get a copy of these slides to look at afterwards. So if we could move to the next slide, I'll just briefly show you those. So on our website at Mental Health First Aid England, if we could go back a slide, that would be great. There's information about that return to work training programme if you'd like to have a look at it. Business in the community have got a number of resources. We'll add this link before we send it out, but the resource that Zara talked about in supporting bereavement, there's also some resource there around supporting BAME colleagues as well. There's obviously the government's website where you can find guidance on safety measures around COVID and CIPD's guidance on returning back to the office. And there's also a link there for the Health and Safety Executive website, so you can go and have a look at their risk assessment templates as well. Huge thank you to our expert panellists for their insight and wisdom in today's session. I hope that those of you who are listening to the webinar today have been able to take a few bits away and tips and ideas to support either your staff who are already back working in the office or staff that you're planning to return back into the physical workplace as well. So a huge thank you to everyone for joining today, and after the session we'll send a link to the slides and a link of the recording of today's webinar too. Thank you very much.